Hello, my name is Valerie Martinez, and today I'm going to be presenting about PTSD, understanding its importance, and how to identify the signs and how to diagnose it overall, know the symptoms, and everything that PTSD is. So, what is PTSD? So, PTSD is a stress disorder. The DSM-5-TR is categorizing PTSD as a trauma and stressor related disorder. It also states that this disorder is affected by psychological factors. It is important to mention that there's two types of stress disorders. There is acute stress disorder, which begins within the 4 weeks of going through a traumatic event. And I mean, it is acute because it's known to not last a while and is characterized by just having fear of everything. But like I said, for some people, it does not like last a while. And then we have post traumatic stress disorder, which is or PTSD. Fear and related symptoms may begin like short after the event. Sometimes it's even like months or years. But 25% of people with PTSD do not develop a syndrome or the diagnosis until 6 months after the trauma. It is also important to mention that a lot of people that first have acute PTSD then develop post traumatic stress disorder. An example of PTSD is this video that I'm about to show you. In 1 second. So I cannot play the video, unfortunately, but this is a clip from Grey's Anatomy. I'm gonna explain a little bit of context. So in this scene, one of the main characters, she is with her boyfriend, her new boyfriend, who is a veteran who just returned from Afghanistan. He's been there for years, and they move in together pretty quickly and he starts living with her. And after a few months, there's one night when he's facing the ceiling and he's looking at the ceiling fan just turning and turning and turning before like between he falls asleep and he's like awake. He starts reminiscing, I guess, about a helicopter. Like it starts like going in his head the sound of a helicopter. And the next scene they show is just him choking the his girlfriend, one of the main characters, and they're stopped by one of his roommates. They intervene and they're like, "Oh my gosh, what's going on? Why is this happening? Why are you doing this to her?" And I think this is the first time I knew what PTSD was, or like an example of it. I was around 13 years old and I honestly thought he was just being abusive to her. I was like, okay, like he just waited until she was asleep to choke her and do this to her because they don't explain it right away. Like, oh yeah, you have PTSD. Like, what's wrong with you? They they mention it later on in the episode. Like, oh yeah, he needs to go get treated. He's not mentally well. He can kill you because he was like in fight or flight mode, trying to choke her, trying to just thinking she was the enemy when she wasn't. That was just his girlfriend. And also, it is important to also mention that this character, the guy that was choking his girlfriend, he also is known for being really impulsive. I think he landed in the hospital and he started working there because he was a trauma surgeon. He did not want to see his family like almost in a year after he got deployed. I think that's what it's called. After he came back from war, he was just there in the hospital pretending he had a whole new life because I guess he didn't want to like face his reality of being back into the normal world. So he like made a whole nother personality because he was traumatized from what he saw. So yeah, he's a pretty good example of what PTSD does to people, and the army overall. So, what are the signs and symptoms of PTSD? There's, like I mentioned in the example of the video that I couldn't play, there's aggressive auras, low emotional state, apathy, like you don't want to do anything, you don't have the need to do anything, you're just there living. There's also headaches, dissociation, irritability, weak immune system, social isolation, shame, feeling of just like shame or guilt, depending on like what kind of PTSD, what kind of traumatic event I meant you went through, sweating and heart palpitations. But where does PTSD come from? Mm, PTSD, people can have PTSD from abuse, either physical, psychological, or sexual abuse, any accident. I know a lot of people, whenever they get into a car accident, sometimes if they were the ones driving, it takes them a long time to drive again, or they get really scared on the road. Assault, if you get robbed, of course, you're gonna be like scared to be by yourself, or you're gonna be on the lookout. Poverty, medical interventions. If you had surgery, people also have like PTSD over maybe losing a limb or just going over a traumatic surgery overall. In natural disaster, violence, like we mentioned, people in that have been in combat usually are the ones that experience PTSD the most, and also neglect. So there's a checklist. I did not mention this on my pamphlet, but a person must meet this criteria to be diagnosed with PTSD. So the first point is to, of course, experience a traumatic event, either death, serious injury, or sexual violence. Sometimes you don't even have to be involved in this event. Just witnessing can be traumatic for a person. The second point on the checklist is at least one intrusive symptoms, such as distressing memories, trauma related nightmares, flashbacks, or being dissociated, emotional distress when being reminded of this event, and physical reactions to whenever there's a reminder of this trauma. Number three would be being avoidant of our feelings, thoughts, and situations that can remind us of the traumatic event. Just not wanting to deal with it is also another sign. Having really negative change in mood or thinking. There's some people that also don't recall the trauma happening. They just block it out of their minds and they don't remember a lot of it because it's a way of coping with what happened. And another one is persistent negative emotions. Number five in this checklist is a change in arousal and reactivity, being vigilant. I'm sorry, being hyper aware of your surroundings, and like if somebody touches you on the shoulders, you react like super scared, like someone is coming to get you, but they're not. No one is getting you. You're just really, you just respond to arousal really differently, and sleep problems as well. Number six is symptoms can cause distress or impairment. People sometimes, once they realize that they've been to a traumatic event, they don't want to do anything. They can't get out of bed. They're just there and can do their regular routine in the morning. So, healing from PTSD. Healing, it is a big word. Sometimes people do not find healing easily because it is a broad category depending on what type of traumatic event, how long this traumatic event went for, and how long this person went for without having a treatment or just even accepting it and then seeking for help. That also matters too on how their healing and like treatment is gonna happen. So a lot of patients first treatment and the most recommended one is of course therapy, but even therapy doesn't make them see a difference until after 12 months of going through it. um, Something that can also be used with therapy would be meditation, muscle relaxation, exercise, finding a new hobby, spending times outdoors, swimming, stretching, and yoga also could really help. I know there's also support groups for it, which I think besides um, therapy will be the most recommended one because just relating with people that went through a traumatic event, I feel like that will be your support system besides your family. It's it's just really important to be surrounded and be understood and heard. So treatment centers here in the valley, we have Tropical Texas Behavioral Health in Edinburgh. We of course have DHR Health and Behavioral also in Edinburgh, and Everyday Bravery Counseling in McAllen. This last one, I was researching for it, and they do take a lot of patients with PTSD. They're really um, patient with them. They have a whole like program for them, of course, like every other ones that I mentioned. They do specialize more in PTSD patients, and they have a website online where they have like a little description of how the therapy would go. I think it's more mostly like encouraging people that are like a little bit ashamed of what they're going through, and it's just really great to know that we have sources here in the valley. When like I said, when I was doing my research, I thought I would be just DHR and Tropical Texas and that's it. But we actually have way more than three centers, but these are the most like famous ones. And here are my citations. Thank you.